Good afternoon, everyone. This is Rebecca Smith-Aldridge, the Executive Director of the Mid-Hudson Library System. Thank you for joining us this afternoon. We decided that even though it was kind of short notice, that you may appreciate some guidance and restarting in-person services at your library. We did a similar workshop for your directors a few days ago. And of course, things are changing, new guidance comes out, stuff is rapidly evolving, but we're starting to see libraries really start to have plans that are taking shape with dates that are starting to look more firm for some libraries more than others, and we're going to cover that today. But our goal is to give you the latest information that we have that we think will be helpful to you in your role as a trustee of your local library, and to answer some of the questions that have come in over the past few weeks since our last session with trustees, to help answer questions about your governing role and some best practices, as well as how to best manage risk in the environment that we find ourselves in today. And I'm really pleased that we're joined with Casey Collin today. He's our library sustainability coordinator and should be someone that you are virtually high-fiving right now because he is the primary author of the Mid-Hudson Library System's phased reopening template that I know many of your libraries are using to fashion your reopening plans around. And we're going to take a look at that document a little bit today and just give you an orientation to it, so you can see why it's something that is useful to your library or could be useful if you haven't been using it just yet. But just to give you a sense of what to expect here over the next hour, we're going to talk about the latest information on when in-person public service can begin at your library. We'll review the intersection of the traditional roles and responsibilities of library trustees and the situation we find ourselves in, which is both helping our staff and our public navigate library services in the era of COVID-19. We've got a restart checklist for you. This is the same checklist we've used with your director, so it might be review for you, things you've already seen. But we know there's questions that trustees have related to that checklist that we want to make sure we make clear. We'll just take a real quick look at the Mid-Hudson phase reopening template features so you can understand why that document is a strong place from which to base some planning on. And then we'll dive into your questions that were sent in advance. As Kirsten noted, you can also use the questions box in the software we're broadcasting from today to add in questions that may occur to you as we're talking. That's totally fine. We'll do our best to get to them. Anything we're not able to get to, we'll get back to you on, hopefully directly, or we'll be able to pull together answers to all these frequently asked questions all into one document that Casey's been working on that answers the questions we've gotten from directors and trustees. So you have that as a reference and a resource for you as you move forward in whatever planning phase your library happens to be in at this time. So the big question that we've been getting over the past week is when can we start curbside service? And there's a lot of, I think, disappointment that we haven't seen better guidance from New York State at this point. I know that the last time we spoke, we had a lot of guesses about where libraries would be mentioned in the phases themselves. At this time, we only have guidance pre-phase one. So that was before the regions opened. And as of today, both of the regions covered by the Mid-Hudson Library System are open and currently in phase one. But we did see guidance, which you'll see in a second on the screen, that allows for public libraries, which covers municipal, special district, and school district public libraries. It allows them to go ahead with curbside, basically whenever you're ready. Whenever your safety planning and policy development and staff training has been completed, you're able to pick a date to launch into curbside service. Now, over half the libraries in our system are association libraries, and there is no current guidance for association libraries of which phase the libraries will fall into. This is causing consternation because a lot of our counties are trying to work together as advised by Mid-Hudson to try to coordinate opening and picking a common date across the county to open up. So we avoid having outlier libraries that might open up way sooner than the rest of their peers in the county so they don't get overwhelmed and create an unsafe situation for their public and the staff there. So we understand it's frustrating and that you wish you had clear answers and clear guidance and that all types of libraries were on the same page, and we feel the same way at Mid-Hudson. We've been lobbying for weeks now to have guidance issued for all library types with the same guidance for all library types. We're continuing those efforts right up until about 12:30 today. That was consuming my morning trying to get our state advocates on the same page and helping to advocate in that direction, which we've been doing for weeks now. But we'll continue to keep libraries up to date on this front as best we can. If you're struggling with this, if you're feeling political pressure as an association library to reopen sooner without guidance, feel free to give me a call. We can walk you through the risks associated with that. that. I'll just mention two things to you. One is that there is a state form for people who feel that an organization or a business that's opened prematurely can be reported to the state, which we're already seeing happen. And we're also very aware and concerned of issues related to workers, that if workers feel poor decision making was made or a guideline was ignored, if they were to later sue the library, is that really the position that you want to have taken? So there's risk management questions to be asked if you decide to move forward without respecting the fact that there's no guidance. And we're happy to talk you through that and help you understand what your neighbors are doing and help you make the best informed decision that you can at this time. So what you see below the second part of the screen is related to the regions and how the state reopened those regions. And this was a much bigger deal before this week, because now all 5 of the counties in the Mid-Hudson region have been reopened. And actually, I just checked, this chart is already out of date from when I did the screen capture this morning, because the Long Island has actually reopened today as well, leaving only New York City as an unopened region in the state. So that puts our 5 counties on slightly different paths. We've got Columbia and Greene County, which were opened last week, and then Dutchess, Ulster, and Putnam, which were opened this week. But all of the system is currently in phase 1. Only public libraries are authorized for curbside service, and we're still advocating for association libraries to get clarity on that front. That is the end of the guidance we have on the topic of which libraries can open when. We know you may hear different things in your counties. We know you may have your own opinions. You may have patrons who are knocking on your doors. Why aren't you opening? But one of the things we really want to stress today is the importance of making really solid decisions during a really challenging time. And we know you have the resources available to do that. This is the actual language you see on what's called the New York Forward Business Reopening Lookup Tool. And this is something you can access on the New York Forward site. We'll make sure you have the link to this if you haven't come across it before. But this is what the only guidance right now available for libraries. When you log on to that site, you pick which county you are in, which was more important when it wasn't clear which regions were open or not. So, right now I did an example in Columbia County. You can pick your own county. It'll ask you to pick the NAICS code. You don't need to know it. You can start typing the word library and the code will pop up for you. But what you see here is an extension, or perhaps an extrapolation of the Executive Order 202.4, which was related to the workforce reductions way back when. If you think back to the first few executive orders, were related to making sure people are staying at home at the rates the government recommended. So what they did was they used that same definition of local governments and extrapolated that to public libraries for the purposes of restarting with curbside or in-store pickup. So it's pretty clear, right? Government facilities only, operating as determined by the local government if such government operates the library, or the library itself as a political subdivision. So we've consulted with the Division of Library Development, the New York Library Association, and lawyers who are very familiar with working with libraries. All are in agreement. This only applies to the public libraries, as noted on the former slide. So for those of you that are ready to go, you've got your house in order. There's certain things that you'll want to follow, including the state's curbside retail guidance and the safety plan that they put forth for businesses, which we're also going to take a look at today. Association libraries, there is nothing at all preventing you from getting ready. And so when we show that restart checklist, that'll be a good place for all of us to focus our attention to make sure all those boxes are checked off before we launch publicly, to make sure we've done our best to protect our library workers and our staff. So when we take a look at the library trustee role in the situation of restarting in-person physical services, we have to take a look at really going back right to the governance role of public libraries and what you've always been focused on, which is the policymaking arm of the organization. You're also responsible for securing funding for the organization and making sure the facility meets the community's needs. And there's obviously intersections here with your role in the governance arm of the organization and restarting library services. It's an extremely risky venture that we need to make sure we've done very deliberately, methodically, and using the best possible guidance that's out there. And so that's what we've been very focused on at Mid-Hudson, is making sure we've collated all that different stuff that's out there, because every time you turn around, there's a new report or a new thought or a new opinion on how to do this right. And so we've been really focused on making sure directors have factual information to make good administrative decisions on, that they are then taking to you to recommend in their plans and their policies. And that really is one of the things we want to emphasize today, realize how hard your directors have been working. We've had almost 100% attendance at our weekly director briefings. We had almost every single library director in the system on our restart briefing for directors last week. We're getting technical questions, left, right, and center. They are working really, really hard on your behalf to make sure they're making good recommendations to you for their planning and your policy purposes. So I think, here in Mid-Hudson, we always try to act like a team, that we can all learn from each other and provide that clearinghouse of solid information for you to make really good governance decisions on. Are we going to be 100% on everything? Probably not, but we're doing our best. And I think when you ask your questions and your directors ask your questions, it all helps us be better as a system. So we appreciate the questions that have been coming in. And so we don't want you to hesitate to ask questions, even if you think, oh, Rebecca covered that last time, or I know Casey told us this. Totally fine. Ask that question. We'd rather get you the right information in a timely manner than have you go around in circles and wonder what other libraries are doing. We can really hopefully get you to quality information in an effective way. That's our goal. So your big role here as the governing body is really to think about risk management, is to protect the library, to protect your workers, to protect the assets of the library, including the library's reputation. So making sure that we've got a good sense of how to minimize risk in this situation is extremely important. We're talking about people's health, our library workers' safety, and the public safety when they interact with library staff and library facilities. So the decisions that we're making, normally we get to be kind of experimental about how we do library policy, and let's see if this would work for our community. This is not one of those times where you want to be extremely experimental. I think we want to go with the best public health guidance we possibly can in this situation. I think there's no reason to rush delivering services until you feel confident you've got a solid plan in place and your staff has been trained on the plan. And so we're going to talk a bit today about your plan and those areas where we know there's going to need to be staff training, and making sure that's being built into your timeline for reopening we feel is really essential. So in the handbook for library trustees of New York State, I always feel awkward quoting myself, but it's always better to prevent harm, right? If we're able to prevent harm, rather than having harm being done and then have to deal with the aftermath of that, someone who got sick because we made a poor choice, or someone who comes back and sues the library because they feel they were exposed to the virus while at the library, either as a worker or a member of the public. When we think about it from that extreme perspective of what's the worst case scenario, I think it's good to reverse engineer our thinking. So let's imagine that worst case scenario, that someone was trying to sue the library because they felt they were exposed to the virus at the library. When you think about the discovery period of that lawsuit process, what do you want to be able to point to say, we did this, we put this in writing, we had a policy that says this, our staff were trained, we took these precautions. Those are all things to think about now and have in place to prevent that harm that might happen in that situation. You can never prevent harm 100%, but I think any reasonable adult can apply common sense and make the best possible effort to do their due diligence, to make good choices on behalf of library workers and the community in this situation. And that's why we focus so much attention at Mid-Hudson over the past few weeks of making sure you have access to good guidance and best practices in this area. We are not taking this lightly, and we know you're not either. So I think if we're all banding together here, we can make the best possible decisions, and no doubt we are going to learn from each other and the other libraries that are already up and running with curbside service throughout the state. So, as we think about the learning, I was just talking to the director of the Monroe County Public Library System in Rochester today. They said within the first 4 days, they totally revamped their procedure for curbside because they learned so much. So the more we can, really work with our colleagues across the state, across the system, in your neighboring counties, the better and better we're going to get at this. So is it going to be perfect the first time out of the gate? Maybe not, but give yourself the license to iterate your policy, give your director the license to figure out how things actually work in the real world, not just on paper, and know that sometimes we're going to have to adjust as we move forward to make the best possible decisions as we go through this situation together. So you still have your ability to meet as boards. You can do so via video conferencing or via telephone. So the same changes to open meeting law that were made way back when, it seems like a very long time ago now in March, they have been extended through June 6th. That is the date the entire New York pause package is extended to. And it still applies for association libraries and people not running businesses or agencies not so far given guidance of how to reopen, which is confusing for people. We had a call this morning with one of our county library associations, and that concept, we've kind of forgotten about New York on pause because we're all focused on New York forward now and reopening. But just remember that still is in play, and that includes the open meeting law adjustments. So the same way you've been meeting up until now, you're good to go until June. I have a weekly standing email exchange with the Committee on Open Government that oversees open meetings law to get a sense of where they think this is going. Will it be extended or not? So we hope to have better information for you before the sunset date on this of whether or not it will be extended. So you'll have to stay tuned for that. So the rest of our time here, we really want to focus on this idea of library worker and public safety and risk management, and having that be the horizon point for decision making, or should we say the lens through which you're making decisions at this time about restarting in-person public services. This, I think we've said several times already in the very short time we've been together this afternoon. So I think you get where I'm going with this, and I'm sure you're feeling very, very similarly. I haven't talked to a single trustee who has not been thinking like this. So I think we're all on the same page about this particular message, at least I hope so. So the restart checklist that you're looking at right now, this has been something that was shared with member library directors, and that I created in conjunction with Casey, who authored the restart, the phased restart plan that we provided to your libraries as a basis for your planning. These are things that we think, in our professional opinion, we've created by cross-referencing things that are mandated by New York State, by things that are best practice, and things that are just common sense. It's very clear in terms of procurement, and I know this is something your directors have worked super hard on, to make sure you have a good supply of personal protective equipment and a supply of appropriate cleaning products to get through whatever phase or level of service you've decided to provide in your library. We have some procedural elements, and these all come from the mandates from New York State, which just came out less than 2 weeks ago. So if you haven't seen these before, that's okay. Don't be worried, they are relatively new, but they are mandated. So these are things you're going to see in the safety plan, which is in the New York State template that we'll show you in a second. But we pulled these out just to highlight them so they don't get lost in the shuffle as you go through that safety plan. These are things, again, your directors are very aware of and are working on. And we're going to talk a little more today about the employee screening procedures and the logs that need to be kept, as those are legally fraught areas that we think trustees need to be extremely well versed in. Your facility preparation, I'm sure you're seeing all types of creative things being done in your buildings, from signage to help facilitate social distancing for staff as they prepare to provide curbside service, to the actual procedural things that need to get done to facilitate curbside service. We're seeing all sorts of creative stuff done in library parking lots. For libraries that don't have parking lots, they're doing different approaches for delivering curbside. We're definitely seeing this as a design challenge, and a lot of directors are doing an awesome job of figuring out what those procedures are going to look like to present to you their plans for how to get this done. The safety plan itself, this is required by New York State. Your director will be doing an affirmation to the state that they have a safety plan that meets the mandates from the state. You don't have to file your safety plan with the state, but it certainly needs to be on site and available if someone requests to see it. So it's much like your sexual harassment prevention training that's required by the state, where you're required to do it, but you never file it with the state. And then if something went wrong and they came back and asked for proof that you had done it, you might want to think of it in the same way. It's required. You have to affirm that it's done with the state, but the plan itself will live locally with your library, just like your other board approved policy documents do. Now, within that safety plan, you're required to have a communication plan, which makes it clear how you will convey the rules for social distancing, for reporting and screening for employees, notification for what would happen if someone got sick, either on your staff or someone who had used library services in your facility. That communication plan is part of the required safety plan. And if you use the template, it's very clear what they're looking for, and you can create that yourself. And the other thing they ask for, which is going to be an unfamiliar phrase for you, which is the proactive infection plan. And it's become a bit of a joke. We all wish it had a better name at this point, but we're going to show you what that looks like. We actually drafted one for you in the Mid-Hudson template, so you don't have to start from scratch. The basic idea behind this is, how do you both proactively prevent someone who may have COVID-19 or be symptomatic from coming to work and perhaps spreading that virus in the workplace that is your library? But what do you do when someone does get sick? This is going to happen from time to time, and how do you handle that? You want to have very clean procedures to address it very quickly. You want to have excellent procedures in place that will help with tracing, so that you can help the health department figure out who that person may have come into contact with. And so we're going to show you how those logs and the screening process intersect with that proactive infection plan to, again, minimize risk, but understand that things will happen and people will get ill. And so we have a really good plan of what to do if this happens. Mid-Hudson had a front row seat to this a couple of weeks ago, and one of our drivers got sick. We didn't know about, there was no screening protocols in place from New York State at that time. We just done our best based on the CDC guidelines that were out there at the time. And when we really reflected on it, when we did kind of a forensic analysis of how we handled that situation, and we isolated the area that person had been in, we sent people home who had come into contact with that person. We had that person immediately go and get a test and confirm whether or not they had it. These are all the types of actions you're going to see in the proactive infection plan that help you know what to do if that happens. And again, minimizes the risk. And for those who have been exposed because of that risk, that you know exactly what to do to help get them to the next level of protection. The policy section that you see there, you can either choose to create one policy that is, your COVID-19 policy that has these various elements in it, or you could add a line or two to existing policies that you may already have at the library that address the specifics of the situation that we find ourselves in. So for example, even public libraries right now are still under the 50% on-site rule for library workforce. So even a public library still has staff working at home. You'll still find over the course of the next 12 to 18 months, you're probably going to be still producing online programming, perhaps not at the volume or pace you've been doing in the past, but it's something that's likely to continue or be part of your repertoire for some time to come. So making sure you've got the procedures in place that make it clear what are the constraints and opportunities when it comes to telecommuting. In the area of personnel, I understand this phrase has not been going over well, of employee dress. What we're talking about are what are the mandates for wearing masks and gloves, or I heard one library is having staff wear aprons. Whatever your dress code is as it relates to personal protective equipment is what we're talking about. So if you have some of your libraries are lucky enough to have a workroom for the staff, kind of behind the scenes, behind the circulation desk. You may say that they have to wear the mask, obviously, anytime they're less than 6 feet away from a coworker. Or you may have a very large library where the desks are very well spread apart and totally meet social distancing requirements, and maybe the staff does not have to wear their masks while sitting at their desks. But you want to have it in writing that anytime staff are interacting, when they are closer than 6 feet from each other, or they're coming in contact with patrons, that they at least have a mask on. Handling library materials, having gloves on, and that's the kind of thing that you'd want to address in the personnel employee dress section. So you can see the patron code of conduct is going to have an issue here. Public libraries, as many of you will recall from your Trustee Essentials workshop you may have attended with myself and Casey, we talk about the fact that libraries are limited public forums. So when you move from curbside service and perhaps start doing service by appointment or opening up the doors to a limited number of patrons to come through your doors, your patron code of conduct will greatly come into play if you have someone who does not want to play by the rules you've set in place. And you have the right to say to people that you must have a mask on. You'll want to have a process in place in your patron code of conduct to help staff know how to handle it if someone will not comply with the rules that you have. We're all watching the news. We've all seen retail environments when people are getting into fight with security guards and retail environments about wearing masks. Your library staff, they're worried about that. They're worried about that interaction and having to have an altercation with someone that's very unpleasant and possibly unsafe for them. They need clear guidance for what to do if confronted with someone who will not comply with the rules of your facility. So again, policies, as always, they create a standardization so your workers know what to do when. It creates a way to treat everyone fairly, from your staff to your public. And it also provides that path that when the worst happens or when the unexpected happens, they have something to refer to. So they know how to handle that situation and minimize the drama of the situation, the liability of the situation, and the aftermath of that situation. So please don't underestimate the importance of policies before you begin restarting library services in whatever form you choose to do that works for your library, your community. Your staff really rely on those policies. So again, your directors as technical advisors, they are daily looking at, for examples. We know they ask us all the time, and we wish we had some better examples, but we're getting there. But again, working together and using that collective wisdom that we have in our system is how best to do this. We're also, of course, in touch with our peers upstate who have already started to get as much resources as we can from them, since they've already done some of this thinking for us. So we're going to continue to curate and build our sample policy area of our site, including the reopening resources on the COVID-19 resources page on midhudson.org. Now, the last thing you see there is staff training. As you recall, perhaps from your Trustee Essentials workshops you've been to in the past with MidHudson, it's excellent and necessary to have the policy, but if no one is trained on the policy, it might almost feel like it doesn't exist. So you want to give your staff a fighting chance to know what the policies are, and your directors are going to be certainly training them on procedures that they develop to produce services and to affect social distancing. But again, there needs to be a staff training plan. So we wanted to show you some of the things that will be in your staff training plan, so you get familiar with some of the phrases and some of the things you'll hope your staff have been trained on. And here's some of the advice that we have on that front as well. So when we refer to the New York Forward Safety Plan template, this is what that all looks like. In case you're curious about that, you can access it right on the New York Forward Safety Plan, the New York Forward website, where you see there it's highlighted in that graphic on the left, forward.newyork.gov. It's a pretty good outline, in my opinion. I actually used it to create a plan for MidHudson, our own staff and office building in Poughkeepsie. It's a great outline. You don't have to use the exact document, but it certainly lets you know what things are mandated, what things are recommended, and what are smart things to have in place from your safety plan perspective. So if you're not sure where to start with that, this is a great starting spot for it. The other really critical documentation that you'll find at forward.newyork.gov is the curbside and in-store pickup retail guidance for employers and employees. So again, important to remember, it's not just you as an employer and your director as the employer doing this work. You've also got library workers who are checking this stuff out, seeing what best practices are, what's mandated. And the state is encouraging employees that find their employers are not following the mandatory aspects of this guidance to report them to the state. So another reason to use this as one of your foundational documents to build your policies and plans on. There's a short form version of this, which you see in the middle, that says Reopening New York, and it's 2 columns that say mandatory and recommended best practices. And there's what I call the long form version of that, which is an 11-page narrative that ties to the items that you see in the short form version with the 2 columns. So both should be consulted when developing your plans and policies. So the Mid-Hudson Phase Reopening Plan template, we were set to release this on a very specific date. Casey was working night and day to work on this. He did a phenomenal job. If you ever get the chance, please do thank him, because he saved your directors, I think, really dozens of hours of work on this. He did an amazing job on it, and I'm not just saying that because I get to work with him. It's really well-respected document that's been tested already by libraries in other parts of the state, as well as our system. It's been run by insurance companies of particular libraries and is holding up. We just want to point out that MidHudson is a library system. We are not public health officials. We did our best to cite everything. We have footnotes, 2 pages worth of footnotes in this document to show you where the information came from. But again, it's for planning purposes only. We always defer to guidance from county, state, and federal public health agencies. And we want to acknowledge that's going to be updated on an ongoing basis. So when we find that that's coming to a tipping point, we will issue a new version of this plan and notate for your directors what's changed since the last time they may have looked at this plan. And that will be one of the challenges going forth over the next few months, most likely. So we definitely advise that you have your insurance company review your plan once you finalized it locally. And libraries are doing this left and right and getting good feedback if they've used the Mid-Hudson plan as their core to build upon, to build what they've done locally. So in case you haven't seen it, I just want to give you a little peek at what the document kind of looks like. It walks you through what policies you need. Well, first, let me back up. It describes different levels of service. So for example, where we've been for the past 8 weeks, for most of you, is providing online services only with no facility access for the public. And so level 1 describes that, and that should be very relatable to you because you've been living that for weeks now. The next level describes curbside and what policies you need to have in place, what personal protective equipment you need to have, and what the operations might look like at that level, and gives a starting spot for your directors to use as the platform to fine-tune it for your local needs using that state guidance about curbside and in-store retail pickup. cross-referencing with the guidance from the Centers for Disease and Prevention, so the CDC, and the EPA and their cleaning guidance. All of that is integrated into this one document. So as you move from service level to service level, it's going to be a little different from library to library, but the bold text in the bold font, that indicates new things in that service level that you're adding on. So for example, you might start out with this kind of new delivery of in-person physical delivery just being curbside service. Maybe that's the only thing you introduce in the first level of service reintroduction. And then maybe when things get a little more stable and clear, you add in by appointment only services. So someone could sign up for an appointment to use the library's computers, or come in to meet with your notary to get something notarized, or to come in for reference or research help on a project they need to work on. And then maybe later you introduce people coming into the building with a head count, that you have an occupancy level that's perhaps half of what you have now to affect social distancing ability. And you figure out a way to count how many people come in the door and ask people to wait once you hit that number, and they can browse the collection perhaps at that point. So this document just helps you describe and think through both the operational and the policy side of those different levels of services. Again, not mandated at all in terms of what services you provide, just suggestions and best practices about the actual service delivery. But what you see here are the mandated safety requirements and the guidance issued by public health officials. That's really not up to interpretation. That's the kind of thing you want to defer to public health officials on. So we integrated those two things into this one document. So the template has a couple of features. As we mentioned, it incorporates those mandated components of the safety plan template, cross-referenced with what I think is a pretty impressive list of public health guidance. It has best practices from the field. We've been studying very hard what libraries in other parts of the country and upstate have been doing to influence what you see in that plan. And then again, each section builds on the next. New additions are in bold. It has a sample proactive infection plan in the appendix, which includes the example employee screening questions, which we're going to take a look at today because we bet you have some questions about that. And again, it's a place to start. You don't like it, it's not working for what you want to do, then change it. It's your plan. Customize it, make it work for your situation. We fully knew we could not build a one-size-fits-all document for everyone. So this is what we've tried to do, is give you the flexibility you need with easy access to the guidance and mandatory items that you need to respect to be able to say you've done your best to open safely, whatever level of service you decide to go with. So we wanted to jump into some of the questions we've gotten. Since we announced this event, questions came in from trustees looking for help. Of course, we helped everyone we could right away, but we always know that when one trustee has a question, it's highly likely other trustees in the region have similar questions. So we wanted to address some of those in our Q&A period. And luckily, Casey's here today, so he can help me with some of these. And again, if you have questions that we don't seem to be addressing or have cropped up as you've been thinking here on the call today, feel free to put those in the questions box, and we'll do our best to get to those today. So we mentioned before there's mandatory logs that must be kept, and there's 3 different logs, and that's kind of buried in that safety plan document that we mentioned before. So we just wanted to highlight it for you because this is the kind of documentation that's going to come into play. If you have someone who is ill and intersects with your library, and then public health officials are looking to trace that person's path so they can figure out who else they came into contact with. I think that's a new word that we're all getting very familiar with, tracing programs, people being trained as tracers. That was part of the metric threshold that had to be met for our region to reopen, is having trained tracers. So these logs will come into play. The cleaning log is required by the state, so making sure it's clear when the area was cleaned last. If you think through using a restroom in a space like a grocery store or a mall, if you're an observant kind of person like I am, you'll have noticed there's a clipboard on the wall, and the cleaning staff marks off the last time they were in there and cleaned surfaces. That's what we're talking about. You might have a cleaning log that your cleaning company uses. If you have staff that does cleaning, you'll be developing that in-house. So that is one tip there. If you have an outside cleaning company, a third party, we'll want to make sure they've been interviewed so it's clear they're using the appropriate disinfectants, that they're cleaning at the frequency that's recommended by the CDC, and that it's being logged through this cleaning log. And it really is as simple as those 3 columns: the date, time, what was cleaned, and the person's name or initials. The other thing you'll have to have is a record of review of employee screening results. And we're going to talk more about employee screening in a moment, but this is an area that was, from my view, I thought very buried in the mandate for the safety plan. But you have to have a record, and hopefully you notice on the checklist that you're appointing someone to be your COVID-19 coordinator. Most likely that's going to be your director. For larger libraries, it might be your HR staff person. But that record of review of employee screening results, one of the points of confusion is there's differing advice and guidance, and I think mandate from the state versus the federal guidance that we see on what to do with the results of your screening of employees every day. So you'll be required to have staff that come in to work at the library to answer several questions that helps raise their awareness they may be ill and they shouldn't come into work that day. And then you have to have your COVID-19 coordinator indicate they've reviewed the results of that on a daily basis and keep a log of the review. Casey will address the keeping of the personal medical information because that's a very sensitive area, but that's what's required, the record of the review of the employee screening results. And then the third log is a contacts log. This again will help with tracing if someone came down with COVID-19 in your circle at your library. So making sure it's clear who was in the library on which days, at what time, and who may have come into contact with someone that has COVID-19. So again, it's requiring your workers that are on site, visitors, and it specifically excludes delivery people. And I should also add here that it specifically says exclude delivery people who are wearing personal protective equipment, not just any old delivery person. I think my guess is the thinking is that the delivery staff have been trained. We know our delivery staff through Mid-Hudson will have been trained, and likely your UPS driver, FedEx driver, US Postal worker will also have been trained on the use of personal protective equipment. But those are, so visitors might be your plumber who comes in to do something, or maybe you have a consultant come in to help you with something. Those are the visitors you'd have in your contact log. You are not required to track patrons. There's an intersection with the public health guidance and New York State law, which protects patron privacy. So you are not required to track patrons, nor is it recommended. However, you might want to have a way to make sure any patron who's used your library recently know if there's been a case that's come up. So for example, in early days in this situation, we had a library where a performer who does a program at the library was diagnosed with COVID-19. And so the director took it upon themselves, because there was no guidance out there for what to do, to notify everyone in that program that they may have come into contact with COVID-19, to watch for symptoms, consult with the county health department. So thinking about your strategies for notification will be important. But again, it is important to note you may not track patron usage of your library through this log, which might be challenging in this situation, but you could have a voluntary place for patrons to sign up if they'd like to be notified. It could be something announced on the library's website or through social media if necessary to broadcast that message. So one of the big questions is what to do if that employee becomes ill, which we were talking about the tracing component of this and the employee screening component. So Casey was kind enough to actually put in the appendix of the phased reopening plan, an actual proactive infection plan, which is required by the state to be part of your safety plan. So I wanted to ask Casey to help walk us through here, because there's three distinct sections of this. There's the employee screening section, there's a section for employees that test positive, and then what to do if patrons test positive. So Casey, I wonder if you're on the line now and I can ask you some questions.
Sure. Yes, please.
Thank you. So under the screening section, it seems to me the intent here is to screen employees before they come into the building. So can you talk a bit about how to go about that?
Yeah, so there's a lot of ways that you can do it. The screening requirement comes directly from the New York State Department of Health guidelines for curbside and in-store pickup. So this isn't something that it was just Casey's idea to test everybody who came in. This is New York State actually requires this for you to be able to reopen. This has to be part of your plan that you submit and write up. So you want to be able to screen all your employees before they come in, and if you think about it, you don't really want somebody who has symptoms of COVID-19 or who might have COVID-19 to come into the library and to, spread COVID-19 to either the other staff that they're working with or to spread it to the customers. So before they come in, ideally, you can administer either an online quiz we've had some library directors talk about doing, or even a phone call or by text if you need to. However, you can screen folks before they come in, and you ask them these questions about, are they experiencing any symptoms, or have they interacted with somebody who has these symptoms, or have they straight up tested positive for COVID-19 in the past 14 days? And so if somebody answers yes to any of these questions, then you're probably going to want them to stay home or to at least not come into the library. And you'll have some procedure that you follow. And so you're first going to tell them not to come in, and then you're going to contact your local health department or your local regional control room, whoever's in charge of COVID-19 for your area, and you're going to want to inform them of what you found out, and then follow the directions from them. Again, as Rebecca said, there's a lot of things that are constantly evolving now, and this contact tracing program is just getting underway, so they might have different guidance than if we had written something here. So they're going to be your experts in this area. So if you find out that somebody has these symptoms, you're going to want to ask them not to come into the library that day. Your telecommuting policy is going to be important here. If they're able to work, if they're not so sick that they can't work, hopefully they can telecommute that day. And then you'll contact the local control room or the local health department, and they'll advise you further what to do. But we do have some steps that you should take below that for if somebody does test positive or reports symptoms.
So Casey, once you have, let's say a hypothetical where you have an employee that's been in the building helping out with curbside, it turns out, their spouse got it, that they got it, and now they're reporting to you that they have it and they've been in the building recently. What are some of the steps that the director or the other staff would need to take to kind of right side the ship after they get that news?
So not to sound like a broken record, but you're going to contact your control room or the local health department and tell them what you found, and they're going to tell you how to proceed next. But you'll tell that person, that employee who's sick, that you don't want them to come in for 14 days if they've tested positive or if they have symptoms. You don't want them to come in for 14 days. Contact the regional control room or the health department, and they'll advise you what they want you to do in terms of contacting folks, whether they're going to want access likely to your log that you were keeping of visitors. Remember, if the plumber came in and interacted with your staff who reported being positive, or if other people who worked on the same shift as this person, other employees at the library, they're going to want to know. Remember, the point of the contact tracing is to let people know that they may be positive so that they can A, get the help that they need and the testing that they need, and B, not spread it to other people. You wouldn't want somebody to find out or to not know that they had it and be spreading it to their family or other folks. That's what we're trying to avoid with the contact tracing in New York State. After you've done that, then there's a little bit of cleaning procedure that you would undertake if they had been in the library recently. And it involves wiping down surfaces and letting the area stand for 24 hours if possible to have the disease sort of disperse, or the aerosols that might be in the air disperse in that area.
So Casey, how about if a patron tests positive? What does that process look like?
So if a patron tests positive, we had a little bit of guidance from an Ask a Lawyer session with Stephanie Cole that helped us out with this. If a patron tested positive and contacted the library, then you would want to contact, again, the regional control room, the local health authority, and you want to see what they had to say. But you have to have the added step. Whenever you're talking about anybody's medical information, even this COVID-19 medical information, you want to be as confidential as possible. There are certain allowances now that COVID-19 is considered a direct threat that OSHA has identified, that we can share information that we might not normally share with local health authorities, not just with anybody, but we observe people's medical confidentiality anytime we're sharing any information as much as possible. And likewise, there'll be an added layer here because you might not be able to disclose confidential patron library information to third parties. So you might take over some of the contact tracing there in order to ensure the confidentiality of patron information.
I think this is a really important point to stress, the HIPAA law, which many of us are familiar with from perhaps your day job or just reading up on that topic. The confidentiality of a library worker, should they be diagnosed, it's important to understand that you may have that inside information, your director may share that information with you, but it cannot be shared with the public. So you can say an employee has been diagnosed and you can let people that you think may have intersected with that person know, but you should not be broadcasting that employee's name in any of your documentation outside of talking to the public health officials. Casey, we're next going to talk about employee screening, but before we go there, was there anything else you wanted to share on this topic?
Just, again, just the confidentiality of the medical records and not retaining any information that you don't necessarily need. There's some conflicting information from the New York State Department of Health guidelines that they gave. They said not to retain medical information like temperatures, but obviously you do need some information about a person who reports having symptoms or testing positive. If nothing else, just their name, so that you can let them know and not just say, yeah, somebody who came in tested positive. That wouldn't be helpful.
Casey, does this screening for the employees, does it need to be done every day?
It does.
Yeah.
Yes, and it has to be reviewed every day, as you said, and you have to mark at least that you reviewed it that day.
Great. So let's take a look at those screening questions. And Casey, where do these questions come from?
These come right from the New York State Department of Health guidelines. So again, not something I made up, but definitely something you see in the first area. We have symptoms, and as we all know, the symptoms change now and then for what can be an indicator of COVID-19. So you're gonna wanna keep your eye on that. If we find that the symptoms have changed according to the CDC, then we will alert libraries as fast as we can. But yeah, that's right where it comes from, is the Department of Health guidance for New York State.
So just to share with everyone, what we've been seeing library directors do is we've seen library directors create a form using Google Sheets, so you can actually have staff take these questions online before they come in for the day. Some libraries have an HR software intersection with this test. So for example, at Mid-Hudson, we use a product called Paylocity, where our staff logs in for the day, their hours, so their time clock, and the quiz with these questions is actually integrated into that process right through the app they use to log in. So you can have an analog approach, you could have a high-tech approach, but it does need to be done daily. Casey, anything else on this topic?
No, we had a question about patrons, and the patron one is an odd situation. That would be if, how would you know if a patron tested positive if you don't keep patron records, of course. But if a patron reached out to you and said, I was there on Tuesday, and I wanted you to know that I was there and that I've tested positive for COVID-19, that's when you would start using that patron plan. It's one of those things that it's not exactly written out in the Department of Health guidance, but it's a way that we can keep people safe.
Great.
But something we got to watch out for is those patron records, the confidentiality of library records.
One of the questions that came through here is whether or not the proactive infection plan needs to be approved by the board. And I think that's a discussion to have with your director, but I think you definitely want to know that that plan is in place and it covers the required and mandated items. So at the very least, board review to make sure it meets the mandated items. You might treat that as a policy itself and then have it board approved. So again, that thinking about it from a risk management perspective, you want to know it exists. That's your, at the very least. And I think the high test there is to actually have it board approved, so you know it meets the mandate with the state and you feel confident about that the staff knows what to do. So making sure that the training for your staff on this topic occurs as well, in addition to the creation of it. So the next topic there is staff training, which we mentioned a few times here. These are just a few of the categories we're seeing library directors getting ready to make sure their staff are trained on. And again, this is part of that whole restart planning opportunity, that you actually need to make sure people know how to put on and off things like masks and gloves. And this is something that's been stressed by the medical profession as well. There are videos available through the CDC and a growing body of sources, just like when the sexual harassment prevention training became required in New York State. And at first we all kind of looked at each other and said, well, where are we going to get that training? And it emerged, right? It was eventually created by the Department of Labor. But right now we're seeing some of these done by the CDC. We're hopeful that the state will also issue some of these. But maybe it's something you just do in-house and your staff takes some training and then they craft their own local training that makes sense for your particular situation. But you'll want to have, and I think this is just a recommendation from Hudson at this point, but I think it makes good sense, is to have a record of the fact that training happened, perhaps even having staff sign off that they received the training, so you can point back to it if anything goes south later on. One of the big questions we've been getting lately are the hours your library is open and can you change them? Because we've obviously had the facility closed for a long time, and the accessibility of your online services has been interesting in terms of thinking about it in terms of the hours of operation of your institution. So something to keep in mind here is that we are dealing with a very unusual circumstance. You definitely can change the hours of the library. You don't have to do curbside for 9 hours straight. You could say, hey, we're going to pilot curbside for 2 weeks and try it 4 hours Monday through Friday. You can make that work for your community. I was on a call today with Greene County Library directors who are being very thoughtful about this, understanding they needed to have evening hours for curbside as well as midday hours and how to best meet the needs of their community. So you can decide that locally at this time. And I know some of your brains are immediately going to, but wait a minute, what about the minimum standards? And this should ring a bell, right? Because we talked about this during the Trustee Essentials workshops. And you're right, there are minimum standards for the number of hours your library needs to be open to stay in good standing with New York State. But clearly, this is an unusual circumstance. The state library has noted that this is, when you report, your director reports about your hours over the year on the annual report to the state, they're obviously going to be saying this was greatly impacted by COVID-19, by the executive orders that required us to work from home. And as we restarted services, there was a significant public health concern that needed to be done in a measured approach. So it's okay that you're currently not meeting the minimum standards. You'll notate that appropriately when you file your report with the state in February of next year. But eventually we'll want to get back to those minimum hours when it makes sense. And so just know you're not alone. All libraries are dealing with this right now, but do the hours that make sense for you. One of the things to keep in mind about hours is that the cleaning protocols put in place might not look like the cleaning that's currently going on in your library. That may mean you need additional hours for that cleaning to be done. So again, thinking about all the different impacts of access to the building, delivery of service, library worker safety, these are all things that will influence the construct of operating hours in the coming weeks and months. And again, the intersection with minimum standards, we hear you, we understand it, it's uncomfortable, but everybody's in the same boat. The state library understands that. And when things shake out, we can get back to those normal operating hours, but for now, we'll need to do what's best for the procedures and the capacity that your library has at this time. So you might remember this chart from the last time if you were on the last trustee briefing. This was related to the types of votes. And I know it feels like I'm taking a sharp turn here and going to a different topic, but it's a timely issue I wanted to make sure you had in front of you, even though it's not technically related to reopening. But really, if you don't have money, you're not going to get very far anyway. So just a reminder with Executive Order 202.26, it did clarify issues surrounding votes for libraries. And many of the school district public libraries and 259 libraries, you've already figured out your path. You're partnering with your school district to have a vote on June 9th. But I just wanted to give a shout out to the special district libraries who have votes post June of this year, and for the 414 libraries. For special district libraries, you're going to want to be keeping your eye out for future guidance on votes. Right now, the only language is that other special district votes will be on September 15th, and we've gotten questions about, well, what about votes that normally would fall after September 15th? Again, no other guidance has been issued, but it has been promised, and it is something that the municipalities in our state are hungry for as well, so we have great allies to influence actually getting guidance on that front, but I think we're not going to see it probably until August, which is going to be dicey when you think about your notification timelines for those votes. Your 414 libraries on the call, I'm with you in solidarity. We've all been working on this issue for months now. We still don't have the guidance we wish we had. Every week when I get a report from the New York Library Association's government relations staff, it is always on her list. She is continuing to bring that up with the governor's staff. But again, the clock is ticking to get something solid on that front, and we just don't have what we wish we had in hand at this time. So I wanted to just kind of say that the money issue here related to libraries. Last call, we talked a bit about local funding, county funding, state funding, and federal funding. We still have not heard from the governor what the cuts for library aid will be. This is obviously nerve-wracking, particularly for Mid-Hudson, since 75% of our funding comes from state aid. You may have noted today the governor is literally in Washington today. He did his press conference from Washington because he's advocating very hard for state aid to be included in the next federal stimulus stimulus package to help reduce the impact of necessary cuts to schools and education like libraries and local municipalities and hospitals. So this is a very fraught time when it comes to funding for libraries and system services. If you're a regular reader of the Mid-Hudson Bulletin, I hope you saw the report from the Mid-Hudson Board. This took up almost all of their time over the past few months thinking through contingency planning if funds are cut, seeking out alternative sources of funding. And so I just wanted to raise your awareness that this is an ongoing conversation. We don't know what the cut is yet for library aid, and that's certainly something your directors are tuned into and getting updates on a regular basis. But just again, that word of caution that if the fiscal landscape for you, either locally at the county level or however state money intersects with your services, just something to be highly aware of and cautious about. But that doesn't mean you ignore your budget right now. You need to be taking a look at your budget and making sure you're spending money appropriately in the right areas. There might be lines you can repurpose to respond to what your community needs right now, as you did when it came to online programming and the production of that. If you think that's something that's going to be done long term, perhaps thinking differently about how money in your programming line is spent, thinking differently perhaps about technology deployment and how you help people connect to the internet. Because if they can't all come into the building to use your public access computers, do you need to invest in more mobile options like a Chromebook or a Wi-Fi hotspot that can be lent out? Looking for grant opportunities in those areas as well. Depends on your community's needs. So just, I would say, don't be afraid of your budget. Make sure you're making good choices with the money you know you have and can count on. Be careful about the money that you don't have in hand yet. As counties and the state and the federal government make hard decisions in the face of what we're all contending here with, it does mean likely that some things we had counted on might not happen. And that has to always be in the back of our minds as we make decisions about our finances in our libraries and through our system. We know you've got questions. I see a number of questions have popped up here, and I wanted to ask for Kirsten and Casey's help to let me know what questions are there that we may not have covered yet.
Hi, Rebecca. This one's fun. Can we get Mark Malinaro to do an announcement about association libraries? He keeps making sweeping statements about libraries. Is that something we can do?
That's a great question, and I would love that too. We'll keep working on it.
But we are in touch with Mark and the county departments and trying to get them to understand the issues, right?
We've had pretty routine, I'd say in the past week at least, thanks to some help from member library directors that have connections in the county government. We've had multiple emails, multiple phone calls, helping them understand association libraries are not the same. You may have noticed they've backed off a little bit on making sweeping statements about all libraries, and they've dialed it down to just municipal libraries, but it still has had an effect on the public who really only hear the word libraries. They don't understand that the state guidance doesn't apply to all libraries. That's a very inside baseball kind of thing. So we definitely know it's a PR challenge for you and putting political pressure on you, and we are working with allies at the county level, with the county directly to try to mitigate that, but it is not the most important thing on their minds right now. So please know we're trying. You can try too, but I think that if we were going to be successful in that, we might have already been successful in that.
Okay. Would we be able to talk about what's happening or what the plans are for delivery, Mid-Hudson delivery?
Sure. So Mid-Hudson Delivery, we are poised and we've negotiated with our courier to begin delivery when we have what we call a super majority of libraries reopen. Logistically, it doesn't make sense to restart delivery if we only have a handful of libraries open. So we will restart delivery and the system-wide holds system once we have at least 44 out of the 66 libraries open. So we've asked our library directors to report to us their plans, what are their start dates, so we can coordinate that with them. However, for now, your patrons will only be able to borrow items that are sitting in your building that your staff can grab off the shelf for them.
Okay. And are any library patrons allowed to go to any library, or are patrons restricted to their own home library?
At this time, that's a local decision since we don't have all libraries open, but the information I've received from the directors that are very close to opening, they are allowing any patron to come to any library. So I would say be aware of that. There is something called the Free Direct Access Plan that's a state regulatory issue that allows any patron to go to any library in a system. So that's in play, but we obviously have a very unique situation here. So we know if we have an uneven opening of libraries throughout the system, system, we may need to trigger some kind of rule. So if we had only 4 libraries out of 66 open, and we were seeing mobs of people rush those libraries, we might have to do restrictions for public health reasons. That's not our goal. Our goal is to have libraries cooperate with each other and have neighboring libraries open in a coordinated manner. But that really is a local decision you can highly influence as a trustee.
Okay. We had a question about who's responsible for screening and logging the screening of the COVID-19 symptoms and contact.
I love that you asked me that question, Casey. I'm gonna
Well,
try
I
to
was,
answer it, and you tell me if I'm
okay.
right or not. But I
Yeah.
think it's that the COVID-19 coordinator that you appoint. So the library director, or maybe it's an HR person in your library. But again, you want to be someone in administration at your library. Casey, what would you say?
Yep, I think that's absolutely it. That's where the COVID-19 coordinator comes in, and somebody should be appointed to that, and likely the library director is probably the best candidate for that. We had a question also about should libraries be taking the temperature of their employees, and you are permitted to do so. You do not have to take the temperature. You do have to have some kind of screening, and it could be taking the temperature. Obviously, remote screening offers some options in that somebody doesn't have to come all the way to work if they are symptomatic. So just to answer that question, yeah, it's not necessary to screen people by temperature.
Okay. So Casey, I see it's 2:30 right now. So what I'm going to
Oh,
just say to the group is that we are recording this. If you need to get off the line right now, please do. But I'm willing to stay another 4 or 5 minutes to answer any remaining questions if there's more there, Casey.
there are a couple. Maybe we can hit them kind of quick.
Sure.
So do you think Mid-Hudson is recommending starting with curbside service and then progressing through the service levels that are laid out in the Mid-Hudson template for reopening?
I think so. I think there's a huge body of knowledge right now as you look across the country of what libraries are doing, that it's a low impact way to begin service and to kind of get our facilities in order without having the public come through our door right away. So I think at this point, 100% of the libraries that I know that are planning to reopen are using curbside as that first step. And that also is reflected in the plan we've put forth for you to model what you do on. I think that is really all that is authorized at this point. When we think about the phase language from the state, really phase 1 only allows for retail in a curbside environment. So regardless of the fact it's not locked in for libraries, I think it's a smart thing to follow that same model as the retail guidance that's come out so far.
Okay. We had another question about if a library staff coworker comes down with COVID-19 and the other staff member worked with that person, does that second person, does that person who worked with the sick person have to quarantine for 14 days? And the answer is no. They can go back to work if they have not had what is called close contact with the person who tested positive or was symptomatic. And close contact means contact within 6 feet of that person without a mask on, without one person having a mask on, or if the person coughed on you and you had, it's called infectious secretions were coughed onto you, then you are okay as long as those things did not happen, if that happened to your coworker.
So Casey, I'm going to say at this point that if there's other questions we haven't gotten to, we'll respond directly to those people and make sure we've incorporated any questions that are of general interest to the group into our print version of the FAQ. If you just can't wait for that print version of the FAQ, of course, email us and we'll get you an answer. But I just wanted to stress that your director is really your technical advisor. They are studying these issues all the time. They're attending our weekly briefings. They're on our notices list and getting up-to-date information. They are, I hope, your colleague and your partner in making good decisions as you move forward. And I certainly hope you consider Mid-Hudson a good partner for answers and advice as you look forward. We're doing our best to take a look at best practices, keep our eye out for that guidance, look for those interpretations of the executive orders, seeking legal advice where necessary. So as we move forward, I'm sure we'll be talking again. We wanted to make sure you had our contact information. Many of you already have this, but of course, all member library trustees are welcome to contact us if necessary, but always start with your director. shoulder. They've really done an awesome job for the most part, from what we can tell, and they are your partner in moving forward here. So thank you very much for your time today, Casey. Thank you for being on the line and helping out with these questions. Some of this stuff is something I'm sure you never expected to become well versed in either, just like our directors and our trustees haven't. So I appreciate your time, and I thank you all for your service to your local library. As always, we know you could choose any institution to devote your time and energy to, and we so appreciate that you've picked your library and that you're really studying up to help keep your library workers and your public safe too. So we wish you the best. We're here to help, and please be well.